Welcome back. As case counts hit record levels in some provinces, governments have been considering some extreme restrictions. Quebec now the first province with a nightly curfew beginning at 8 p.m. In Ontario, Premier Doug Ford says all options, including a curfew, are under consideration. BC's restrictions on gatherings will remain in place at least until early February. All of this comes as officials are also keeping a close eye on variants of the virus spreading. And we're joined by infectious disease specialist Dr. Zane Chagla and Dr. Lenora Saxinger. And doctors, both of you have expressed concerns about the COVID numbers in your province. So let me start with you, Dr. Saxinger. Do you think a curfew would be an effective measure in Alberta?
You know, it's really hard to know how much a curfew would add. When you go out and about in the evening, which I don't, but if you happen to run some errands, it does not look super active at that time of the day. And the whole issue is, will a curfew make it clearer for people to decrease their number of contacts with others and provide a bit of a harder endpoint for people to measure against when they're deciding what they should and should not do? There's some jurisdictions where it does seem to be quite helpful. And I think that, you know, it can be on the table if you're having problems for sure, but you'd want to follow up and see if it's actually doing what it needs to do.
And Dr. Chagla, it sounds like it may be on the table in Ontario. From your perspective as a doctor, do you think a curfew is the right way to go?
Yeah, I think that folks that are congregating after 8 o'clock, you know, can find a way to congregate one way or another after 8 o'clock with or without a curfew. And I think we really do have to think seriously of what the downstream effects of a curfew are. You know, there are still many different things that are not being addressed in Ontario's response in terms of sick pay, access to testing, access to safe isolation, community supports. I think if you haven't really squeezed the juice out of that lemon, you know, going down the lines of curfew and saying you're going to just resolve some gathering isn't necessarily going to give you the benefits that you want and really cause some downstream effects.
Something I'm really interested in hearing the answer to. Both of you in your practices are speaking to people who are infected with COVID, you know, have just gotten the news. Dr. Saxinger, first to you. Where are they telling you they're getting it?
Well, I mean, it's quite a range. I've definitely had people allude to, you know, pre-Christmas interactions or, you know, dropping off presents at the door, unmasked brief encounters. And quite commonly, people don't really describe much by way of risk activity. And then sometimes you hear things about, you know, workplace gatherings and workplace spread, certainly. And so it's quite a range still. But to be honest, I do wonder if there's a bit of minimization potentially when we're asking that history.
Yeah, can you imagine how hard it is for the contact tracers to try to get straight answers to that? Dr. Chagla in Hamilton, what are patients telling you about where they're getting COVID?
Yeah, absolutely. I mean, I think there was some activity over the holidays. There is people that may not be entirely truthful because of the stigmatization around this disease. But there's also family members, people that, again, go to workplaces, come home and infect family, healthcare workers, unfortunately, that have gone home and infected their family. And so, yeah, it's a myriad of different settings, some of them that are preventable and some of them that really aren't, given some of the transmission that's occurring.
Two other topics I want to deal with before I let you go. And Dr. Chagla, let's start with you on this. The NHL season is supposed to start in just a few days. Today, the Vancouver Canucks announced they were canceling their practice because of potential COVID exposure. So not as a hockey fan, I'm asking you to answer this as an infectious disease doctor. Do you think this is a good idea to have the 7 Canadian teams traveling across the country playing starting this week?
Yeah, I mean, last year was great. In the NBA and the NHL, they put it in a bubble. You know, as long as you controlled everything going in and out, you really made a very safe concept. With players now in their own homes, interacting with their families, interacting with the public, unfortunately, we're going to see transmissions occur in the NHL, and it's just inevitable in that sense. The hope is with repeated testing that it doesn't have rippling effects. And I think with the repeated testing as well, it's not likely going to have effects in terms of significant community transmission. So, you know, I think we have to give it time to see if this model works. It's more humane for the players. There's a huge platform here to communicate with people that haven't been reached by public health measures. But, you know, we do have to reevaluate. If we're seeing significant transmission, then maybe reconsidering the season back in a bubble to end it.
And Dr. Saxinger, I can't have you guys on the air here without asking about the variant. Lots of concerns out there. how do you feel about the existence or likelihood of the variants spreading in Canada?
Well, I think it's very, very concerning because the data that's come forward is actually pretty consistent that there are variants that seem to spread more effectively. They don't necessarily make people sicker, but if it spreads more effectively, it affects community transmission a lot. A lot more people get sick. So it has effects. We're right now trying to figure out whether these are actually actively spreading in Canadian communities. A lot of the labs are working on higher speed surveillance testing to see if we can screen for the presence of these, because I really do think it would change things. If either the UK variant or the South Africa variant are actually becoming common in the community, we really have to up our game in terms of the prevention of transmission in the community as we're rolling out vaccine. So I would call myself concerned and watching closely.
All right. Dr. Saxinger, Dr. Chagla, thank you very much for spending time with us.
No problem.
Pleasure.